Bismillahirrahmanirrahim. Assalamu alaikum, my dear first year students. I am Dr. Asma Saddique from Anatomy Department. Welcome back from the spring vacations, and I hope you have enjoyed your vacations. Now we will continue further the online teaching, and we are going to discuss today about the general aspects of the bones, and the topic is blood supply of the bones. So first of all, I would like to recall with you the parts of bone generally, as you have seen, that this is the shaft of the long bone, which is cylindrical and is having the bone cortex and medullary cavity. This is known as diaphysis. And the ends of the bones, which are either proximal and distal, these are the epiphyses of the long bone. So this is the proximal epiphysis, and here you can see this is the distal epiphysis of the long bone. So when you see the different components of a bone from outer to inner side, you will see that the outer aspect of the bone is covered by a protective fibrous covering, which is not only a protective covering, but it is also having the osteoprogenitor cells towards its inner layer, which is going to become the osteoblast whenever needed for the bone formation. This is the periosteum. So this blue color here you have seen, that is the periosteum of the long bone. Then inward you go, this is the typical osteons and eversion system you can see, and indicating this is a compact bone, so that is making up the bone cortex. Then beyond the bone cortex, these trabeculae, they are showing you the pattern of the bone, which is typical of a spongy or cancellous bone, and its junction, which is the junction of a compact and spongy bone, that is known as endosteum. And here you can see this is the endosteum, which is the junction of the compact and the spongy bone. Then inside, this is a medullary cavity or canal, which is going to have that yellow marrow most of the time in the long bones. So this is a marrow cavity or the medullary cavity. So hope you understand these different parts. So thinking all are going to move towards the blood supply of the long bone. We will divide the blood supply of the long bones into two categories. That is the blood supply of the mature or adult long bone, and the blood supply of the immature long bone, that is the bones of the children. So that I will continue first with the blood supply of the adult long bone, that is the mature adult long bone. So there are four sources of the blood vessels which are supplying a long bone. These are: number one, the nutrient artery, that is also known as a diaphyseal artery, and this nutrient or diaphyseal artery is going to enter inside the bone through the nutrient foramen. I hope in the dissection classes you have seen the nutrient foramen, how it looks like. So that nutrient foramen is going to this is going and continue inside into the bone cortex as a nutrient canal. So from the nutrient foramen, these nutrient artery or nutrient blood vessels, which is accompanying the vein also, they are also called diaphyseal artery, because these are entering through the diaphysis of the long bone. So remember, the other name for nutrient artery is diaphyseal artery. So from the nutrient foramen, it enters into the nutrient canal, which traverses the cortex of the bone. And you know that the cortex of the bone is mainly composed of compact bone. Then there is the periosteal artery, as you have seen that fibrous covering, and this outermost fibrous periosteum, this is going to have the periosteal blood vessels. So these are the periosteal arteries, which are also going to enter into the bone. Then are the metaphysial artery and the epiphyseal artery. So first I am going to tell you about the epiphyseal artery, because you know about it that this must be the artery of the epiphysis of the long bone. So this artery that is going to enter into the epiphysis, and then this is going to become divided into its spongy bone. This is the epiphyseal artery. It enters just above the epiphyseal line. So the metaphysis, that metaphyseal artery that is going to pass through the metaphysis, which is the area of the diaphysis just below and just adjacent to the epiphyseal cartilage. So this one area here, you can now appreciate this is the metaphyseal artery, which is going to enter into the bone and participating in its blood supply. So this is entering into the area of the bone which is called metaphysis. So this is just below the epiphyseal cartilages on both ends of the bones, and these areas are called the metaphysis of the bone, which is basically more prominent when this is a mature growing bone. So here you have seen the 4 sets of the blood vessels: nutrient artery or the diaphyseal artery passing through the nutrient foramen, periosteal arteries, the metaphyseal artery, and epiphyseal artery, which is also known as retinacular artery. So if someone is going to ask you about the retinacular arteries, you must understand it that this is the other name of the epiphyseal artery. So these are the 4 sets. Sometimes the question regarding the blood supply of the long bone start from enumerate the arteries which are supplying the adult long bone. So what enumerate means, you have to just name them. So if you have to name them, just write them 1, 2, 3 and 4, these names of the blood vessel, which is going to cover your component of enumerate the arterial supply of the long bone. So you have to just name them. Next here again, now you can see that this one that is showing you the area of nutrient foramen, which is passing into the compact bone into the bone cortex as a cortical canal. So this is a nutrient canal which is having and which is going to show you here the passage of the nutrient blood vessel. So along with the artery, the vein is also accompanying, you can see here. Then here you can see this is the periosteum, the stripped off membranous structure you can see from the bone here. This is the periosteum, and from here the periosteal blood vessels, these are going to enter, which soon going to ramify and enter into the Volkmann canal and then anastomose with the diaphyseal artery. Okay, we will discuss its detail later. Then again you understand, I have told you the area just adjacent and below, that is the part of diaphysis which is just close to and adjacent to the epiphyseal line, that is called metaphysis of the long bone. What is metaphysis? Which is now the area just below the epiphyseal cartilage, and this is the part of diaphysis towards the epiphysis, and here it is showing the rapidly growing cells for the longitudinal growth of the bone in the young children. So that is showing you here that metaphyseal vessels. Then above this epiphyseal line, you can say outer to this epiphyseal line here, you can appreciate there are the epiphyseal blood vessels. These are epiphyseal artery and vein here you can see, and these are entering inside into the epiphysis, and this is the articular cartilage which is covering the epiphysis, and this is the area of the joint formation. For that we'll use the terminology articular. That's why this is articular cartilage. So I hope here you can now understand the epiphysis, and from here the blood vessels which are entering, we labeled them the epiphyseal blood vessels. Then is the metaphysis, which is a part of diaphysis just close to the epiphyseal line, and that is the rapidly growing diaphysis. So this is metaphysis having the metaphyseal blood vessels. Then is the shaft, remaining shaft, that is diaphysis, and from here the diaphyseal artery or the nutrient arteries are going to enter. And from the periosteum there is the periosteal blood vessels. So these are the four sources of the blood vessels which are supplying the long. Now one by one we are going to discuss about the detail of these blood vessels. First of all, the nutrient artery, which you have seen is also called diaphyseal artery. This is the nutrient artery and this is the branch of the regional blood vessel which is passing through that area. And suppose if I say this is a humerus, then there is mostly you must see that the nutrient foramens are present on the posterior aspects. So humerus is having this nutrient artery from the profunda brachii blood vessel. If it is a tibia, again I told you that this is mainly at the posterior aspect where nutrient foramen are mostly present along the posterior surface of the long bone. So posterior tibial artery is giving nutrient artery to the tibia. So here you will see that this nutrient artery, that is the branches from the major systemic arteries which are present in that region, and they are giving high pressure blood flow to the bones. So this nutrient artery is a source of blood that is at a higher pressure because it is the branch from the major blood vessel of that area. Then this is passing through the nutrient canal as it is traversing to the cortex of the bone, and when it reaches to juxta and osteal zone, which I have told you is the junction of the compact bone and the spongy bone, here it is divided into the ascending and descending branches. So at juxta and osteal zone, this diaphyseal artery divided into ascending branches which moves proximally and descending branches which moves distally. These ascending and descending branches are also known as the medullary arteries. These are the medullary arteries. Then these ascending and descending branches, they are ultimately going to reach towards the metaphysis, and here it is going to anastomose with the metaphyseal artery, and in adult long bone also with the branches of epiphyseal artery. And some of its branches, they act as the end arterial loop, mean they behave as the end artery. They are not going to give any branches, rather they are going to end up directly into the venous sinusoid which is present in the medullary canal. So I know this is a bit crowded picture, but that would explain you all about the diaphyseal and nutrient artery and its branches very clearly. So from here you see that the diaphyseal and nutrient artery, as it enters obliquely into the nutrient canal through the bony cortex, and then at juxta and osteal zone, which is the junction of the compact and spongy bone in the long bone, then it divides into ascending and descending branches which are known as the long medullary arteries. These are ascending and descending branches. So first of all, number one, this diaphyseal artery, as it continues into the medullary artery, these branches are going to anastomose with the branches of metaphyseal and epiphyseal artery which are present here in the adult long bone. So number one, these branches are making anastomotic channels with epiphyseal and metaphyseal blood vessels. Number two, some of its arteries, they behave as end arteries. They act as an end arterial loop which directly terminates and end up into the venous channel. So these are not giving any branches, rather they are going to and directly into the venous channels. Number 3, these are here, you can appreciate that these medullary arteries, they are going to give further the circumferential rami, which is running along the whole of the circumference of the bone. So these are the circumferential rami. So the medullary arteries at number 3 point, they are going to give the circumferential rami. So these circumferential rami, then they are going to give further two types of branches. Number 1, which are running towards the center, towards the medullary cavity. These are the central branches. That these branches, they are going to unite with the venous sinusoids present in the medullary cavity. So here the blood flow, which is from outer to the inner side towards the center, we label this is the centripetal flow of the blood. So the circumferential rami is giving the central branches which are showing centripetal flow of the blood. So these are also the central or centripetal branches. Then these are further giving the cortical branches. Here you can see these are the cortical branches which are running towards the cortex of the bone, moving peripherally, and then they anastomose with the periosteal blood vessels. So these cortical capillaries, these are the branches from the circumferential rami. These are moving towards the periphery and they anastomose with the periosteal capillaries. So here they are going to show you the centrifugal type of the blood flow. This centrifugal blood flow means the blood is moving from inner to the outer side. So from inner to outer side towards the periphery, when blood is flowing, then we label them, it is a centrifugal type of blood flow. So these are labeled as centrifugal branches as well. So here what you have seen, that the nutrient artery, which are the diaphyseal artery, they are giving number 1 ascending and descending branches, which are the medullary arteries. Number 2, they are having the end arteries, which are directly ending up into the venous channels. And number 3, they are giving the circumferential rami, running along the circumference of the bone, and then they are giving two branches, central and cortical. The central branches, these are giving the blood towards the venous circulation into the medullary cavity, and the cortical branches run peripherally and throughout the cortex and then anastomose with the periosteal branches, which are also running in Volkmann's canal. So for the outer 1/3, periosteal arteries is supplying the blood to the bone, and to the inner 2/3 of the bone cortex, it is supplied by the cortical branches of the circumferential rami, which is the branches from medullary artery, and in turn these medullary arteries are the branches from the diaphyseal and nutrient artery. Here you also see that these are the muscular vessels present in the muscles, which are attached to the periosteum of the bone, and through that arteries they are giving the branches known as periosteal. Again here this is a picture which is showing you number 1, the nutrient artery going to run into the bony cortex at juxta-endosteal zone, divided into ascending and descending branches. Then from these branches, which are medullary arteries, these are also called medullary arteries, and then these are further dividing into the central branches. These central branches, running in the bone marrow and ends up into the central venous sinusoids present in bone marrow, and ultimately they drain the venous blood into the central vein present in medullary cavity. So sinusoids here, that is the typical picture of a dilated venous channel which is the expanded one. This is called sinusoids. So here in the marrow towards the center of the bone, they are going to enter into the venous sinusoids. So these are the central branches showing you the centripetal flow of the blood. And then these branches, look at them, these branches 1, 2 and 3, these branches entering into the bony cortex and moving towards the periphery, and then they anastomose with these vessels which are actually the branches of the periosteal vessels. The periosteal blood vessels, they enter into the Volkmann canal and then they end up anastomosing with the cortical branches of the circumferential rami of the medullary arteries, which are further the branches from diaphyseal artery. And these again you can see how these are going to be the circumferential blood vessels giving central and cortical branches. So here you must remember that the diaphyseal and nutrient artery is giving the inner 2/3 of the cortex, then the juxtaendosteal zone, then the spongy bone and to the bone marrow. This whole component are supplied by the diaphyseal artery. And the outer 1/3 of the bony cortex is supplied by the branches of periosteal blood vessel. From this picture, you can clearly understand this area of supply, the outer 1/3 of the cortex by periosteal vessels, and inner 2/3 along with all the inner structure of the bone along with bone marrow are supplied by the diaphyseal or the nutrient artery. Now moving on to the next, that is periosteal artery. As I have already discussed with you, these are now the branches which enters through the periosteum. These are the numerous branches present mostly in the area of the muscular attachment and the attachment of the ligaments. So that's why these are the major artery which is supplying the muscle to that region which is attached to that bone, is giving periosteal artery to that bone. Then these arteries divide into branches entering into Volkmann's canal, as clearly you have seen in the previous picture, and then it is supplying to the outer 1/3 of the bony cortex. So I hope it's clear to you now. Here again a very beautiful picture for you showing you the area of supply. This is the periosteal vessel and how beautifully now you can see entering into Volkmann canals. And now I hope from these pictures you are also clear about the osteons or the eversion systems, which are these cylindrical structures and making up the bony cortex, and they are the compact bone. And outer 1/3 in these osteon, the blood vessel in their center eversion canal is from the branches of periosteal artery, and the inner 2/3 is going to be supplied by the nutrient artery. And here this is the area which I am saying again and again, between the compact and spongy bone, that junction, this is the juxta and osteal zone, where nutrient artery divided into the ascending and descending branches, and then further it divided into the central and cortical branches. So again here very clear to you that from the periosteal arteries into the Volkmann canal, the outer 1/3 cortex supplied by periosteal artery, and then inner 2/3 along with spongy bone and this bone marrow and medullary canal is supplied through the diaphyseal artery and its branches. Now the third source of blood supply to the bone, that is the metaphysial artery. And what is the metaphysis? I hope now you understand that is the part of the diaphysis or shaft of the long bone which is closer or adjacent to the epiphyseal cartilage or epiphyseal line. So that part towards both ends which is showing you the rapid growth here, that is the metaphysis. So this is mainly more prominent and very richly vascularized, mostly in the children where the bones has to grow. And now after the epiphyseal cartilage which is going to disappear, means that is going to become ossified. At that time, the branches of the metaphyseal artery very frankly anastomose with the epiphyseal artery and with the branches of the medullary arteries, which are further branches from nutrient or diaphyseal artery. So here these three blood vessels, epiphyseal, metaphyseal, and the branches from medullary artery, as you have seen in the previous slides, these are going to anastomose together. So whenever there is a fracture or any break in the blood supply towards these areas, suppose if here is the fracture line, then from this fracture line, then the blood is going to cut towards the proximal side, and at that time these metaphyseal and epiphyseal artery, they are going to compensate to the blood flow to these area. So the blood supply will not be compromised even if there is a fracture in the adult, because there is a very frank anastomosis together between these three vessels. Now these blood vessels, which are the metaphyseal arteries, these are the branches from the neighboring vessels which are running close to that area. Then these are also the branches from the joints, the blood vessels which are supplying the joints. These are making the articular vascular arcades, very rich anastomosis and plexus sort of arcades are going to be formed by the blood vessels which are going to supply the joint. So these epiphyseal as well as the metaphyseal arteries, these are the branches which are branches from the articular arcades, the articular anastomosis present along the joints. The metaphyseal artery runs along the attachment of the fibrous capsule, and then they enter into the metaphysis. So they move towards the metaphysis, where they end up by making anastomosis with the medullary arteries and with the epiphyseal arteries. In the adults, remember, when the epiphyseal cartilage has become ossified, and now the epiphyseal artery again, which is the branch from the anastomosis around the joint, these are making the arterial arcades, and from here the vessel is entering into the epiphysis by many vascular foramina present at the ends of the bone. If you will study the long bones during dissection class, then you will notice there are numerous foramina which are present towards the ends of the long bone at the epiphysis. So these foramina are for the passage of the branches of the metaphyseal and epiphyseal blood vessels. So these epiphyseal blood vessels passing through these foramina enter towards the spongy bone. I hope now you remember that I have already told you that the epiphysis is mainly having the spongy bone and it is filled up with the red bone marrow. So towards that spongy bone, this is going to give many numerous branches, and then these branches, they are going to anastomose together as well and making these arc-like arcades. So these are the arcades. So these are making the arterial arcades. Then these blood vessels, they are making the end arterial loops which are going to return the blood into the epiphyseal vein. So many of the branches from these arterial arcades, they end into the end arteries, which are directly transmitting the blood towards the venous circulation. So they are making end arterial loops. And some of the branches then anastomose with the branches of metaphyseal artery. Now moving to the blood supply of immature long bone, and keep in mind that all the component we have discussed till now, that was about the blood supply of the mature long bone or the blood supply of adult long bone. Now this is the blood supply of immature bone of the children, where there is the presence of this growth plate or the epiphyseal cartilage between the epiphysis and diaphysis. And I hope now you understand why we need this epiphyseal cartilage to be present here in the children. Yes, of course, for the growth of the long bone and to prevent the immature and early fusion of diaphysis and epiphysis, this growth plate and epiphyseal cartilage allow the growth of the long bone in longitudinal manner. So in the children before puberty, we don't need that fusion at all. Otherwise the bones remain the short. So in the children, in this case, the difference is only the presence of that epiphyseal cartilage here, which is between epiphysis and diaphysis. What about in adults? This epiphysis has become ossified, and here what you have seen in that area is just the bony epiphyseal line. So here in the children in immature bone, this epiphyseal cartilage is present. So because of the presence of this epiphyseal cartilage, definitely there will be no anastomosis possible between the epiphyseal arteries and the diaphyseal arteries and metaphyseal arteries below. So above, towards the outer side of this cartilage is the epiphyseal blood vessels. They are not going to anastomose with the metaphyseal artery and branches of the medullary arteries below that or inner to that epiphyseal cartilage because of the presence of this cartilage. So there is the anastomosis which is between epiphyseal vessel, metaphyseal blood vessels and the terminal branches of the nutrient artery, that is completely absent. So there is no such anastomosis, and that is absent in the immature long bone due to the presence of that cartilage. And here this is to show you after the fusion, these metaphyseal arteries, epiphyseal arteries and the branches from the nutrient arteries, they are going to show you this anastomosis when there is the ossification of that epiphyseal cartilage after puberty in the adult long bone. So number one factor which you have studied is that the epiphyseal and metaphyseal arteries are separated because of this epiphyseal cartilage. And very interesting to note here that this cartilage receives its blood supply from the epiphyseal arteries, and the metaphyseal artery is also going to supply its inner aspect, which is towards the diaphysis. So this epiphyseal cartilage, it receives its blood supply from the epiphyseal artery and metaphyseal artery at its both ends. Then there is the periosteum, and this periosteum is also having osteoprogenitor cells helping in the bone formation and in the bone growth. So the periosteum is also very vascular as compared to the adults. And the number 4 component, the difference between the mature and immature long bone is that Metaphysis is also highly vascular. It is richly vascularized, having lots and lots of blood vessels which are going to enter into the metaphysis, that is very prominent. But then they are going to make up the hairpin bends because of the presence of this epiphyseal cartilage. Their ends, they are going to bend. So when they bend, then at their bent area, the bacteria and other microorganisms can easily trap there, and this is leading to the infection known as osteomyelitis. Osteo for bone. Osteo is for bone and myelitis is for the bone marrow. So the infection of all the components, bone and bone marrow, is known as osteomyelitis. So osteomyelitis is more common in the children because the metaphyseal arteries, which are very more in number, they are going to bend into a hairpin like loops, and at that bend the microorganisms, they easily lodge and trap there, causing the inflammation in this area. So why osteomyelitis is more common in children, that is a very important question. Mark it with 4 stars. That is very important. It is more oftenly asked in the exams, also during viva. So I hope you understand it here. Again, I'm going to tell you that the metaphyseal arteries, which are more in number, and they are going to make the hairpin like end arterial loops. So at these bends, they are the microorganisms trap easily, so they are giving you the osteomyelitis, the infection and inflammation of the bone. So here you can easily understand how the hairpin loops looks like. So as I have told you that the metaphyseal arteries, because of the presence of this cartilage, they showing that bent. So these bent, which you can see, they are making the hairpin loops. So these are called hairpin because these resembles the hairpins as used by the girls. So all the girls who are using that black color hairpins, they can easily understand that they are showing a bend between two strands of the pins. So these bent here, that is indicating the hairpin bends or hairpin loops because of the metaphyseal artery, as the epiphyseal cartilage is present here. So here these can show very easily the foci of the microorganisms, as along these bends the blood flow is also very sluggish. So these bends, they allow very slow flow of the blood, and when the blood flow is sluggish, the microorganisms, they can easily lodge and trap here, leading to the inflammation at this area, and this inflammation is. Before moving to the topic of the venous drainage of the bone, my dear students, here I would like to advise you, please listen to me carefully, that whenever there is a question of blood supply, then you have to mention arterial supply as well as venous drainage of the bone. Because you know that a blood vessel mean artery and vein together. So if it is a blood supply, never forget to write about its venous drainage. Until unless if there is a question about the arterial supply of the bone, then you just have to write about the diaphyseal artery, epiphyseal, metaphyseal, and the periosteal arteries. But if it is a blood supply, along with that arterial supply, you also have to write about the venous drainage. And I'm going to tell you again and again, but even you make that mistake during second year, as there are the many questions regarding the blood supply of viscera. So please never forget about venous drainage if the question is the blood supply. So for the venous drainage of the bone, you have seen, along with all the arteries you have discussed so far, they have accompanied vein as well. So these accompanying veins, these are responsible to drain the venous blood in reverse order. As the arteries, they are carrying the blood towards and inside the bone, but the veins, they are draining the blood in reverse from inner to the outside of the bone. So for the long bone, as you have seen, this is the diaphyseal artery. It has its accompanied vein as well, which is again the branch from which is going to enter into the same named vein, as it is accompanied the artery which is giving branch to the bone as nutrient or diaphyseal artery. So the long bones, you have seen here the central vein inside the medullary cavity. So from this central vein, whole of the blood is ultimately going to pass through the nutrient vein, and then this is draining this venous blood into its respective vein that accompanies the artery, giving that nutrient artery. So also number 2, there are the periosteal veins. As you have seen, these cortical branches which are going to anastomose with that periosteal arteries. So their accompanying vein, they are draining the blood into the periosteal veins, and ultimately from periosteum they are draining that blood into the muscular venous channels which are present in the muscles. The metaphysial and epiphyseal vein definitely draining the blood from proximal and distal ends of the bones, and also from medullary cavity. They are draining that blood into the corresponding venous channel present along the joint and fibrous capsule. So these are all about the venous drainage, as they are draining the. Now there are the further questions about the blood supply of the short bones, because what is the difference now? You have seen the short bone has no epiphysis and no diaphysis. So how come it is going to have the epiphyseal and diaphyseal artery? So omit that. It is only going to be supplied by the periosteum, which is covering it. So these vessels, they enter through its non-articular, the one which is not taking part in the joint formation. From that non-articular surface, the vessel is going to pass into the bone, and it is supplying to the compact and the spongy bone, as well as the bone marrow which is present in it. So for the short bone, it is going to be supplied by only the periosteal blood vessels which pass through the periosteum. So there is no epiphyseal and diaphyseal artery, please remember. Then the other one here you have seen are the bones which are the irregular bone and the flat bone. What are the difference in the blood supply of these bones as well? So you must be clear about that the flat bones, they are going to receive the blood supply from the numerous vessels present along its periosteal plexus. So again here they are supplied by the periosteal blood vessel. And there is, you have seen the flat bones are the sternum, then are the scapula, and also these ribs. These are labeled as the flat bones. These ribs actually, they are going to have the nutrient artery as well. So rest all the flat bones are receiving periosteal blood vessel, but the ribs are, along with periosteal artery, is also having a nutrient artery. Then this irregular bone, which is basically, you have seen the vertebra and hip bones, they receive the blood supply again majorly from the periosteal blood vessels. So these penetrate into its compact bone, and then also they supply the spongy bone inside the bones. So these are typically supplied by the periosteal blood vessels, and some of them are having the nutrient artery as well. So the message to you is that actually the long bone is having all that 4 sets of blood supply: diaphyseal, metaphyseal from here, then epiphyseal and periosteal blood vessels. Rest other, the flat bones, irregular bones, and the short bones where the epiphysis and diaphysis are absent, they are mostly receiving the blood from periosteal vascular plexus present along these bones, and some of them, as this rib is having the nutrient artery as well. So I hope you understand here the topic of the blood supply of the long bone. Students, this topic is very important. So here I end up with all about the blood supply of mature adult long bone and blood supply of the immature long bone of the children. So whenever there is a question on blood supply of immature long bone, mention all the arteries which we have discussed along with that differences which you have seen. They are present in children and immature bone due to the presence of epiphyseal cartilage. I hope you understand it very well, but still if you have any problem, if there is any query, please contact me and I will resolve it at the moment. Thank you very much.